This is the Chapter 16, Segment 1 outline for behavioral neuroscience. We're going to get started with how schizophrenia was diagnosed in the past. In the early 20th century, people were diagnosed with paralytic dementia, which is the sudden onset of delusions, grandiosity, poor judgment, and impulsive behavior. People with paralytic dementia would show to have Argyll-Robertson pupil, which is where the pupil will did not constrict in response to light, but did constrict when the person was trying to focus on an object. They found out that this disease was a result of brain damage from syphilis, which is known as syphilitic psychosis. And now we use epidemiology, which shows that mental disorders are more common nowadays than they were in the past. Depression is more common in females, and addiction is more common in males. Depression and antisocial disorder peaks at the ages of 25 to 44 years old. Eugen Bleuler introduced the term schizophrenia. Through English, it kind of means split personality. However, it doesn't. That's not what Bleuler meant. He identified the key symptom as dissociative thinking, which is a condition seen in schizophrenia that is characterized by disturbances of thought and difficulty relating to events properly. Other symptoms included with schizophrenia are emotional disturbance, delusions, and hallucinations, and as well as paranoia, abnormal emotional regulation, and bizarre disturbances of thought. A lot of people think that schizophrenia is most commonly attributed with visual hallucinations, but actually most people with schizophrenia only experience auditory hallucinations. There are 4 major symptoms today associated with schizophrenia. They are auditory hallucinations, highly personalized delusions, false beliefs, changes in emotion, and cognitive changes. People with schizophrenia experience strong emotions, believe they experience strong emotions. However, this might not be that they themselves actually experience emotions very strongly. It's just that the way they express their emotions appears very strong through their facial and body signals. And also, people with schizophrenia are known to experience things such as positive symptoms and negative symptoms. Positive symptoms refer to a behavior that is gained in a disorder. Examples of these are hallucinations, delusions, and excited motor behavior in schizophrenia. They also experience negative symptoms, which is a symptom that reflects insufficient functioning. And examples of this are emotional and social withdrawal, blunted affect, and slowness and impoverishment of thought and speech. There is a genetic component to schizophrenia, but stress increases the likelihood. So that's why you can have a pair of identical twins, and only one might have schizophrenia and the other doesn't. They use through adopted person studies to confirm that genetic factors are present in schizophrenia. And then they also perform twin studies. And first, there's 2 different types of twins. There's monozygotic, which are the identical twins because they split from one zygote. And there's dizygotic dizygotic twins, which are fraternal twins because they came from two separate zygotes. When both individuals of a twin pair suffer from schizophrenia, they are described as concordant for this trait. However, if only one twin out of the pair has this disorder, the pair is described as discordant. So this means that genes aren't the only answer. For monozygotic twins, 50% of them have people with schizophrenia or concordant for the disorder. And then for dizygotic twins, only 17% have twin pairs are concordant for the disorder. So that higher concordance rate among monozygotic twins shows that there is a genetic factor. They have also found that one reason this might occur where both twins might not have schizophrenia is that usually the symptomatic twin weighs less at birth and had an early developmental history that included more instances of physiological distress. And during development in childhood, the twin that was low birth weight was more submissive, tearful, and sensitive than the identical sibling, and was often viewed by the twins' parents as being more vulnerable. They found that the inability, getting into the behavioral distinctions that can be objectively measured by various neurophysiological psychological tests would be eye tracking movements. They used eye tracking movements, which is recording eye movements while the person's gaze follows a moving target on a computer screen. That people with schizophrenia were unable to use smooth movements of the eyes to follow the moving target and had an intrusion of rapid, jerky eye movements. And this symptom suggests that schizophrenia might have been associated with an endophenotype. So researchers found that there's 100 genes that influence the development of schizophrenia. However, only a few genes are found to be abnormal. One of them is genes encoding neurogenin 1, which participates in NMDA, GABA, acetylcholine receptor regulation, cybindin, which is involved with synaptic plasticity, COMT, which is for metabolizing dopamine. And also, it was found that people with schizophrenia have a mutant gene called disrupted in schizophrenia 1, which is DISC1 shortened. Normally interacts with many other proteins during brain development, especially the ones that are involved with synaptic plasticity. Epigenetic factor is another epigenetic factor is paternal age. It's found that older fathers are more likely to have children with schizophrenia because their sperm has more mutations. So getting into ventricular abnormalities, many patients with schizophrenia have enlarged cerebral ventricles, especially the lateral ventricles. Ventricular enlargement is not related to the length of illness or to the duration of hospitalization, however. Patients with ventricular enlargement, the extent of enlargement predicts the responsiveness to antipsychotic drugs because patients with more enlarged ventricles tend to not respond well to these drugs. Transgenic mice with the mutant DISC1 have enlarged lateral ventricles. However, it's found in both humans and mice that overall brain size is not affected, so that means that these enlarged ventricles occurred by causing less brain tissue overall. The hippocampus and amygdala help form the walls of the lateral ventricles. An atrophy of these two structures could cause enlarged ventricles, which could result in abnormalities in the limbic system. Disorganized hippocampal pyramidal cells from abnormal synaptic arrangements of inputs and outputs of cells result in the disorganization that arises from early development of cells. It also possibility could be an abnormal corpus callosum, and also which could result from a more accelerated loss of gray matter at adolescence in schizophrenic patients than the controls. Another finding was an impaired frontal cortex, which in PET scans showed less metabolic activity in the frontal lobes. This could be known as hypofrontality hypothesis, but in some cases people only showed hypofrontality when performing cognitive tasks. Next, back in the 30s, a treatment for schizophrenia was a lobotomy. And doctors said it reported miraculous recoveries. However, this might have been wishful thinking on their part. Because it made the patients more sedative. However, they were very rarely able to leave the institution, indicating that they weren't actually cured. An example of this was a 12-year-old boy was given a lobotomy. He was named Howard Doley because he was a bit rebellious, and his stepmom took him there. Today, now, we use psychosurgery, which causes smaller lesions. However, it's rarely performed and only as a last result. In the 1950s, however, as doctors became more skeptical about the lobotomy, a drug, chlorpromazine, was developed, and it quickly replaced the lobotomy as a medication. This drug reduced the positive symptoms of schizophrenia. And chlorpromazine was much better than a lobotomy, not only because the drug treatment is reversible while lobotomy is not, but because the drug actually worked. Chlorpromazine,